Hi, thank you for joining me today to learn a little bit more about breast cancer or reinforce what you already know. The information provided in this presentation is intended solely for educational purposes and cannot substitute for professional medical advice. The views expressed in this presentation are my own and do not reflect any hospital or healthcare network. I have no financial disclosure or conflicts of interest with the material in this presentation. Worldwide, breast cancer has now surpassed lung cancer as the most commonly diagnosed cancer in women. Since the mid 2000s, invasive breast cancer in women has increased by approximately 0.5% each year. Now, this is despite a large percentage of women being scared off of estrogen and hormone replacement therapy in the early 2000s for fear of an increased risk of breast cancer. That'll be a topic of a future talk. Now, although black women are diagnosed less often with breast cancer than white women, black women have a 38% higher death rate from the disease. The 5-year survival rate of early localized breast cancer is 99%. The American College of Radiology recommends annual screening mammograms beginning at age 40 in normal risk women. Dr. Lucille Adams Campbell was the former director of Howard University Cancer Center. Her research primarily focused on understanding health disparities. Dr. Adams Campbell and Dr. Lynn Rosenberg from Boston University Medical School worked together to launch the Black Women's Health Study in 1995, which is a longitudinal ongoing study. What she found was that black women have the highest rate of breast cancer mortality in the United States, the highest incidence of mortality due to colon cancer, and are twice as likely to die from cervical cancer than white women. The American College of Radiology listed black women as high risk and in need of earlier breast cancer screening in 2023. Mammograms. What about radiation dose? Isn't this risky? One of the more common things I encounter are women concerned about the radiation dose from a mammogram. As it turns out that the radiation dose of a single mammogram is similar to that of a cross-country flight. And what I always tell patients, if you aren't skipping your next flight to your vacation, don't skip your mammogram. The radiation dose is not cumulative and does not build up over time. The average American receives several-fold higher radiation from natural sources such as the sun or soil. Don't skip your mammogram. What about the pain from having my breast compressed? Isn't this a legitimate concern? When you think about it, the compression itself only lasts for about 10 to 15 seconds per image if you're getting a 2D, 3D mammogram, and only about 4 to 5 seconds if your facility does 3D only mammograms. The total time under compression for a standard screening mammogram is typically a minute or less. So in terms of screening tests, I just go to my happy place when I'm getting my mammogram and I just put it in perspective relative to other screening tests that I have, including pelvic exams and colonoscopies, and I just kind of push on through. So here we see a woman being positioned for her mammogram. The chart to the right deals with breast density, and our breast density refers to the amount of fibroglandular tissue relative to the amount of fatty tissue in the breast. Fat tissue shows up as a gray color on the mammogram, whereas fibroglandular tissue shows up as a white color. And cancer shows up on the mammogram as a white color. So the denser your breast tissue is, the harder it is to detect a breast cancer, and also the more fibroglandular elements you have in your breast also put you at increased risk for breast cancer. So when you have the category of heterogeneously dense or extremely dense breasts, we do recommend that you get supplemental breast screening. And in my practice, we offer breast MRI, which is the most sensitive test that we have to detect breast cancer. So MRI is the most sensitive breast cancer screening test, and it is not affected by breast density. It uses powerful magnets, radio waves, and a computer to make images with a lot of detail. It also uses intravenous gadolinium contrast dye to light up the cancer. So this is an image of what your breast MRI looks like. And the bright white round ball at the top of the image on the left is what the cancer looks like. And to the left, we see that this is what the tumor looks like outside of the breast. Here are a few examples of mammograms in different patient scenarios. Patient A to the left gets annual screening mammograms. She develops a cancer. It's very small. We're able to see it, and She's able to get her treatment and likely get a cure at that 99% rate. Patient B skips mammograms. Her tumor is definitely a lot larger than patient A, but still treatable. Patient C, it's much more advanced, doesn't get routine screening at all, and she's presenting with what we call inflammatory breast cancer, where it's involving the skin, the lymph nodes, and the axilla, and also sometimes it's spread throughout the body. So I put this in the category of optional suffering, and this is a scenario where we need to opt out of this presentation. So how does cancer and vitamin D interplay? So the vitamin D receptor and vitamin D enzymes are expressed normally in the breast and in the majority of breast tumors. Vitamin D exerts tumor suppressive effects in the breast cancer. Vitamin D deficiency is common in breast cancer patients, especially in those with aggressive disease. There is an association of higher vitamin D status with delayed recurrence and improved survival. Correction of vitamin D deficiency has the potential to improve outcomes in women living with breast cancer. Going a little deeper, the vitamin D regulates genes involved in cell cycle control, apoptosis, which is programmed cell death, autophagy, which is cellular recycling, angiogenesis, which is tumor blood vessel growth, and immune modulation, which helps our immune system recognize and destroy cancer. Chronic deficiency may reduce the vitamin D receptor in breast tissue and tumors. A lower vitamin D receptor expression is associated with more aggressive tumors and poor prognosis. Restoring sufficient vitamin D levels could potentially enhance vitamin D receptor expression and improve tumor responsiveness to treatment. Back in September, when I did a poster presentation at the Indian section meeting for the American College of Gynecology, I learned about this program, and this is through the Indiana Department of Health. It provides free screening for breast cancer as well as cervical cancer for women that qualify. And I also learned that there are similar programs all across the country at your state department of health. So this is something that you can look into if you cannot afford to get your mammogram or cervical cancer screening. Thank you for watching this presentation. Just to wrap things up, all women should have a breast cancer risk assessment by age 25 to determine if earlier than 40 breast cancer screening is needed. Black women and Ashkenazi Jewish women are high risk. Annual screening mammograms begin at age 40 for normal risk women, and no skipping, ladies. Maintain vitamin D sufficient levels at or above 40 nanograms per milliliter. My preference is 40 to 80 nanograms per milliliter. Some people say 40 to 60 nanograms per milliliter, but what I know it's not, it's having a level of 3 or 12 or in the low teens. So thank you.